the first shot may have been administered to you. And for many of you, maybe it has not, or maybe you've already taken both and you still have some questions or you're wondering about some things. We have professionals that can help on tonight. We want you to know that the Urban League, along with the NAACP of Greenville County, is so happy to bring tonight's session to you. It is not the only information session. There will be an information session that I will announce again at the end on February the 25th at 1:30. And it is titled for our faith leaders. It is the audience will be our faith leaders. And we're grateful for the medical professionals that will assist us then. Our young professionals also have events that are coming up that will also give information. And then our local medical university is partnering with the Urban League for another event. So hopefully, no matter what age, what stage of life you are in, hopefully you can invite others and that information will be given. I want to thank our panelists today, and we will allow them to be introduced in just a moment by the diversity and inclusion personality, Melinda Gillespie, and she will give her official title. But listen, they have brought to us our events and our health forums in the past, our minority health forums in the past, and they are still giving us wonderful information today. There are a couple of housekeeping matters that we want to share with you. And that is, if you have any questions at all, we ask that you would type them in the chat section. So please, all questions in the chat section. We also ask that everyone would keep your audio muted during the session, in order that everyone can hear clearly and that there will be no interruptions. And then we will ask that you will please turn off your cameras, so the video feed. We want to make sure that it is smooth the entire time. And one way to save some of the bandwidth is if you would please turn off your cameras. So thank you so very much. At the end and after our panel discussion, Reverend Stacy Mills, who is the board chair of the Urban League of the Upstate and also a National Urban League board member, will lead and moderate any of our questions and answers. So if you would please just place your questions in the chat, he will get to those at the end. I also want to welcome our Facebook audience and our YouTube audience. Listen, to our Facebook audience that's watching on the Urban League of the Upstate Facebook page. Thank you so very much. You can type your questions in as well. And then those who are watching by YouTube tonight on our Urban League of the Upstate Project Ready GVL TV tonight. Thank you so much. So to our young audience that's watching through Project Ready, thank you to all of our students. Thank you to all of our parents who are watching. Listen, on tonight, we already have close to 100 people registered just on this platform, not including our platform from social media. So thank you. So without further ado, let me turn it over to Melinda Gillespie to introduce our special guest, our panelists for this evening.
Pastor Dogan, thank you so much. I can just listen to you talk all night. Thank you so much for just bringing awareness about this community education vaccination forum. Thank you for accepting the invitation. We really appreciate it. We give honor to you, sir, and also to the Urban League of the Upstate and the great work that you're doing in the community, as well as Pastor Stacy Mills and the NAACP leadership and representation on this call tonight. Thank you so very much for being here, and thank you for the privilege of your time. I'm Melinda Gillespie. I'm the Executive Director for Diversity and Inclusion at Prisma Health. I've been with Prisma Health, formerly GHS, for 13 years now. Many of you know me as the executor and the manager of the Community Health Summit that we promoted in our community for 10 plus years, really advancing health promotion and caring for our communities and addressing health equity and health disparities. So very excited to be here with you tonight. I want to take this opportunity to introduce our panelists who will bring you some valuable and critical information tonight from Prisma Health. First off, I want to introduce Dr. Carrie Cease. Dr. Cease, if you could just wave your hand. Dr. Carrie Cease is our Medical Director of Accountable Communities at Prisma Health, and she is also on the leadership of the Prisma Health Vaccination Task Force. So a wealth of information that we have here tonight from her, as well as our physician leaders at Prisma Health, Dr. Kevin Springle, who is a general pediatrician at Prisma Health and has been with Prisma Health a number of years, a wealth of information and advocacy from him tonight. So thank you, Dr. Springle, for being here. And also Dr. Cedric McFadden, just a great friend and confidant. He is the colorectal surgeon for Prisma Health, very advanced and integrated in community outreach and education. And so just want to thank Prisma Health physicians and leadership for being here tonight to address some of your questions and challenges, and also address vaccination hesitancy, especially within communities of color. And so we want to come face to face with you tonight to answer some of those questions, to reduce any anxiety, dispel any myths or fears, and also bring you the information, the most current and up-to-date information about where we are right now with the vaccination rollout. So with that, I'll ask Dr. Carrie Cease just to give us a brief overview right now about where we are with the vaccination rollout and how we're serving our community. Dr. Cease.
Thank you, Melinda, and thank you, Pastor Dogan. And thanks, everybody, for sharing a little bit of time with us tonight. So I'm just going to very quickly and briefly review where we are in the vaccine rollout, and certainly be available to answer any questions as they might come up throughout the evening. So we are in phase 1A plus of our rollout. And as you are probably aware, the phases of the rollout are really dictated and decided by the CDC, and then the state itself also has a vaccine advisory committee that helps determine how we perhaps subcategorize within our own state. So there is some state control of how the vaccine gets rolled out. That is all run by DHEC right now, and then it gets approved by the governor. So in phase 1A is healthcare workers, and that does not just include physicians and nurses. That's anybody who works at a healthcare facility, long-term care facility residents, as well as long-term care facility workers. And then now we have extended to the 65 and over category. So as of this Monday, we went down to 65 and over, regardless of health conditions. So just age of 65 and older. And that is what we are currently in the process of vaccinating. On DHEC's website, there is a vaccine locator, so you can go and find out where vaccines are being delivered across the area. So there are some local pharmacy chains that are giving vaccine, as well as health systems. Each area that is designated as a vaccine site is given a certain allotment of vaccine from DHEC. We request on a weekly basis what we think we'll be able to use. At Prisma Health, we do that based on the registrations or appointment schedules that we have and how many people are in the queue to be able to get vaccinated. So we put in a request each week, and then we are given an allotment from DHEC. Oftentimes, the allotment does not meet the request that we have. And that is due purely on vaccine availability within the state. The state has an algorithm of which they follow of how they give vaccine across the state. This week, you may have seen on the news or seen on social media that we had a delay in getting our vaccine supply. So we found out on late Friday that they were going to change the way they distributed the vaccine. And we were then left with a little bit of a short supply for this week. And so where we were able to accommodate walk-ins in the past at our what we're calling mass or mega vaccine sites. So in the Upstate, that's at the old Kmart Plaza across the street from Greenville Memorial Hospital. We had to really limit our walk-ins and really postpone some of the vaccine appointments that we had for the first dose vaccines so that we could accommodate the second dose vaccines. So all this to say that it's a pretty complicated process of how the vaccine delivery comes to us and how we manage those appointments. So currently at our sites, we have open at Hillcrest, Patewood, Baptist Park Ridge, out in, so that's Columbia, sorry, Baptist Easley and Greer, as well as our Kmart site. I will put in the chat later the vaccination sites at Prisma Health because those will be changing. And that is going to change to better manage the vaccine administration. We know that at the Kmart site, we can be incredibly efficient. And so we are consolidating some of our vaccine sites and sending them all to the Kmart site. Again, just because the throughput there can be so much greater, also allows us to manage our vaccine supply a little bit better. That being said, we understand that coming to a vaccine location is not the best way to get vaccine out to potentially vulnerable populations. So we are actively creating our mobile vaccine strategy. I believe there was a press release today about how we hope to have that up and going in the next couple of weeks, maybe even sooner, depending on vaccine supply and our staffing availability. In Greenville County, through funding from the CARES Act that was given to Greenville County, Prisma Health was able to purchase 3 mobile units to be able to serve our community and really go to outlying areas, as well as to, high areas that were hit hard by COVID, and where we know that there's not broadband, not access to be able to schedule an appointment on the current system, which is MyChart. And again, I'll put all that in the chat so you can see exactly how to access that. So we are actively working on our plan right now. We have data from our sites that tell us who has been coming to the vaccine sites, but more importantly, who has not been coming to the vaccine sites. And there's 2 questions with that is, are people not coming to the site because they don't have access, and that's where the mobile units can come in, or are they not coming to our sites because they're not quite sure they want to have the vaccine? So we're also doing a 2-armed approach at education. Tonight is one of those. So bringing people to talk about that so we can identify hesitancy, talk about myths, talk about issues so that we can alleviate those fears. Again, so you can make an educated decision for yourself whether or not the vaccine is right for you, but also to really engage with our community leaders about how do we get access for people who aren't as digitally literate to get access to computers. So we have a community toolkit that we have developed to help our community leaders help people in their community, whether that be in your church, in your neighborhood, et cetera. And again, I can make sure you guys all have a link to that so you can sign up. We can train your team on how to access MyChart and get people those appointments. And then lastly, we want to work with our community leaders looking at our data of where we don't think there has been accurate access to the vaccine, so we can identify those locations to bring the mobile unit. And then when we identify those sites, really work with our community leaders to get people scheduled to come and have their vaccine done. And I want to point out real quickly that we will not be advertising those mobile sites broadly. That will be done through a network of our community leaders, because we want to make sure that those appointments are not taken up by the general public. We don't want that to be a location site that people can pick. We want those to be reserved for the populations where we know who aren't having access. So we will manage those appointments completely differently, working with our community leaders to get people signed up so that we aren't seeing people come and take those appointments that were reserved for a population who otherwise might not have access.
Thank you so much, Dr. Cease. That was a great overview. I want to take the opportunity to ask Dr. Cedric McFadden if he can share just a little bit about his experience. I know there's been a lot of concern about the side effects and adverse events associated with the vaccine. And I know that Dr. Cedric McFadden and also Dr. Springle have both received the vaccine, and I think up to now the second dose as well. So I would like to ask if you all could just kind of share a little bit about your experience in receiving the vaccine, if you received or if you had any side effects or adverse events, and any additional information you'd like for this group to know. So,
Sure.
Dr. McFadden.
Thank you. Thank you, Melinda. Thank you, Carrie, Kevin, Pastor Dogan, Pastor Mills. Thank you for hosting and inviting and really getting this very important information out. So I received my first dose December 19th. The second dose I received January the 6th. Both doses were the Pfizer. I think I anticipated having some significant side effect just based on what was circulating out. And really the only thing I really experienced was arm soreness at the site of the injection, the same as I would have gotten if I'd just gotten the flu shot. Nothing more than that. I think a few times I anticipated having a little bit of a headache, and maybe I was willing that in, so I took some Tylenol after the fact. But it was relatively an uneventful experience. I do think that everybody's experience may be different. And I have continued to advocate that if those symptoms, if you begin having any of those side effects, such as arm soreness, fatigue, fever, headache, those are good side effects, right? Because that means your body or your immune system's ramping up. It's doing what it needs to do to help you fight off any potential infection with COVID. So my experience was fairly underwhelming from a side effect standpoint, but I certainly had a lot of excitement and pride and all the good stuff, because we've had this whole conversation about COVID for over a year, and we're at that point. So it's a miraculous moment that we have, and I was just happy to be able to take part in this amazing technology that we have. So, but that was my experience, and looking forward to sharing and speaking with you all and answering any questions you may have tonight.
Excellent. Thank you so much, Dr. McFadden. So Dr. McFadden stated that he had an underwhelming experience. And so we'll go to the opposite end of the spectrum with Dr. Kevin Springle and have him to share a little bit about his experience with the vaccine. Dr. Springle.
Hey, good afternoon. Welcome. Thank you for having me. So my experience wasn't bad. I had my first shot on Christmas Eve, right? So I wanted it Christmas Eve. And so I can't remember when the second one was. It was probably about 20 to 21 days afterwards. The first shot, my arm hurt pretty good, like to the point where I couldn't sleep on it. So it was a little more sore than what I'd experienced with other shots, probably similar to a tetanus shot. That tends to hurt a little more. The second vaccine, about 27 hours later, around lunch on Friday, I was at work, and at lunchtime, I ended up under my coat because I had chills. I don't know if I had a fever at that time, but I just kind of had some chills and aches and just a little tired. I worked the afternoon that Saturday. I kind of had some aches and chills a little bit, but not bad. I took some Tylenol probably later Saturday. So overall, not much more significant than flu vaccines that I've gotten every year for over 2 decades at this point. Probably a little bit more significant than that, but that's a good thing. It means your immune system is working. And the flip side of that, I guess I need to bring up, is if you don't have side effects, it does not mean that the vaccine didn't work, because we're saying that, yeah, that's your immune system ramping up. But the flip side of that is if you don't feel anything, you still should be producing antibodies and doing well on that side of it too. So, but that was my experience. Was happy to have gotten the vaccine for sure. So thank you.
Thank you. So Pastor Dogan, Pastor Mills, I've placed some details what Dr. Cease was talking about as far as our vaccination rollout and what phase we're in. And so I've put that information in the chat. And then Dr. Cease has also put information about the community toolkit that she's referring to that has a wealth of information about the vaccination rollout, what phase we're in. about the vaccination demand and some of the critical information that our community needs to know. And so those two links are also in the chat. And so just want to pause for a minute to see if there's anyone who has any questions or concerns or challenges at this point in time in our forum. So Pastor Mills, if you could please lead that.
Sure. We do have a couple of questions. The first one to Dr. Cease is a question regarding appointments and standing in long line. I'll just read it as it's posted here to me. The question I have is why those who have appointments have to stand in a long line. Should there not be a separate line for them?
So that is a good question. I know in the beginning when they were managing walk-ins and those with appointments, there were two lines. I think the reason that there is a line now, and I have not been to the vaccination site in a couple of days, but I think that the reason there is a line now is because while they're not separating the walk-ins from those with an appointment, those who because of vaccine supply, they are still allowing walk-ins for people for the second dose. So I think they're trying to work those in. I know my parents went today for their second dose and they were in and out in 30 minutes. So I don't know if they're fixing that process. They have industrial engineers coming on site. They're doing time studies. The goal is certainly not for people to wait 2 hours. What I can say is that Prisma Health is dedicated to trying to find efficiencies where we can, so that we can improve that experience for everybody.
Thank you, ma'am. The next question that we have is related to arriving for the second dose, and the participant writes that she and a relative had an appointment today to get a second vaccine. Received a call not to come. They were out. What should we do? My relative is 80 years old and not able to stand in the long line.
So in that first, I believe it's in that first link that I shared, they are still encouraging second doses to walk in, particularly if it's been 26 days or more since you've had your first vaccine. They are putting people whose appointments have been canceled on a callback list. They are preferentially going to be scheduled first once the vaccine supply is available. So you are able to walk in for the second dose. However, it is first come, first serve for that. So again, I know this is not a great experience. And once supply is back up, this week was a very unusual week because the supply did not come as was expected delivery date. And then we also had less supply coming. So again, I know not terribly satisfactory answer, but you can walk in for the second dose. You may have to wait a little bit. I think what I would do is you could ask at the time that you got there, what do you think that particular wait time was looking like? Again, I know from the time study today, they were trying to estimate that, and then they were going out into the parking lot so people were not coming in to have to wait, so that they're trying to manage those expectations.
Dr. Cease, I'm going to apologize because most of the questions are coming in your direction. The next one also, in the participant writes, if an individual had COVID and was a positive diagnosis and was issued convalescent plasma therapy and remdesivir, should they still get vaccinated? And I may not have pronounced that last medication, remdesivir, remdesivir.
You did great. So a couple different ways to answer that question. One, if you've had COVID before, absolutely, yes, you should still get vaccinated. So if it's been 10 days from your infection, you can go ahead and get vaccinated. So just because you've had COVID, we don't know how long the antibodies last. And so the recommendation is that you still get vaccinated. The convalescent plasma, I'll have to look that up. And Dr. Sprinkle or McFadden, if you know that, I don't know what the time frame is for that. The remdesivir, which is monoclonal antibody therapy, and the other one is bamlanivimab. If you've had a monoclonal antibody treatment, that's 90 days before you should get vaccinated. I am not sure about the convalescent plasma, but I can look that up quickly and give you that idea. But monoclonal antibody therapy is 90 days. If you've had COVID and just have natural immunity, you can get vaccinated within 10 days of your infection. And I will look up the convalescent plasma unless Dr. McFadden or Dr. Sprinkle know the answer off the top of their head.
I don't know the answer to that question.
Answer forthcoming. We'll wait.
Yeah.
The next question, and thank you, all three of you. Thank you so much for your patience as we kind of navigate through some of the questions. The next question has to do with homebound community members. And the example, well, the statement is Medicare does not allow home health to give vaccinations, even the flu. Is Greenville County doing anything to address this? And the participant says that they've reached out to their mother's physicians and they don't have any suggestions.
So DHEC is working on the process for homebound. I do not know the details of that, but that is something that DHEC is working on in terms of identifying. I think they're going to be working with pharmacy chains to do homebound. That was the last I heard from DHEC.
Okay. And you may have spoken to this already. One of you may have. The statement is, I have a husband with very serious health issues, and I have called Prisma and tried to sign up with my chart, and there are no dates available. And when I called the number on my chart, the customer service representative told me it would be months before there is an opening. What else, or who could I contact? What else should I do?
So the appointments are updated real time as vaccine supply. So sometimes a flurry of appointments will open up when we have the vaccine supply. Right now, the first dose vaccines are a little bit more challenging because we're trying to ensure enough vaccine for all of the second doses. Right now, the number of people we have registered for the vaccine or who are in the queue to get an appointment is over 100,000. So the good news is a lot of people want to take the vaccine, which is awesome news, for us as healthcare providers. The not so good news is our demand way outstrips the supply that we have for us right now. So my advice would be, please be patient, keep going on to my chart, because you never know. As soon as the supply is available, appointments will open up. So where you might not see an appointment today, once we have supply, you will see those appointments open up. So go on to my chart frequently. Again, once we have some access with these mobile units, it may be that we can also bring the vaccine to you. Again, that will be in limited supply. We are hoping to get additional vaccine dedicated to us for the mobile rollout. We have not gotten confirmation from that yet. We do know the state is getting additional, I think it's a 10% increase from the federal government. So that will mean that we hopefully would get a 10% increase as well. But it is a week by week decision that we unfortunately do not know the answer until our allotment comes. And the answer to the convalescent plasma is also 90 days.
90 days, great. A few more questions. If you received Pfizer first, is it okay to receive Moderna as the second vaccination?
Yeah, I would say only under dire circumstances. I think in general, the goal is to receive the same vaccine for your first and second dose. But I don't think it's totally contraindicated if there were no other way to get a booster and the timing was off. I think they have said that it's okay, but it's not really advised. So, but preferably it would be the same vaccine both times.
Okay. The participant writes, I take Fasenra injections. is it safe for me to take the vaccination? Dr. McFadden?
Yeah, I'm getting off of mute. Oh.
Let me spell that that medication, FASENRA, FASENRA injections.
I don't think, as a general rule, there are not many, and Carrie and Kevin, please stop me if I'm speaking at a turn here. I don't think there are many medications, if any, that are contraindicatory for the vaccination. There are probably some conversations about allergies that raise some of the concerns about getting vaccinations. But in general, the medications that you take, whether it be for immunosuppression, whether that be for blood thinners, blood pressure, diabetes, are not contraindicatory to receiving the vaccination. But obviously, if you do have history of severe allergies where you're taking, EpiPens and you have them with you on a daily basis, you want to talk with your doctor and have some other arrangement around you getting the vaccination. But I don't recall there being any medications that are that raise the red flag right out.
I just want to indicate here that I looked up that medication, and I don't know if the participant is on the line and can hear, but are they taking that medication for asthma? So it is for asthma. It is one of the indications for asthma. So any contradictions for the vaccine for those taking medications or any injections who have asthma?
Again, I think it depends on the severity of that. If you have severe, meaning you've been on life support before because of your respiratory issues or allergies, you may want to talk with your doctor about those concerns. But otherwise, that's the reason why we have the vaccination, is to protect people who are at high risk, such as having lung disease, heart disease. That's exactly who we want to prevent from having severe issues with COVID.
And that participant has specified that they do have COPD, Dr. McFadden, or Dr. Springle, and Dr. Cease.
Again, so that is the population that we really want to protect from COVID with the vaccination. So even more so, why you should be considering and getting the vaccination.
So the next participant, and thank you, and I want to preface this one with I truly thank each one of you before asking this question. The participant expresses gratitude for your presentation tonight and asks, how safe is the vaccine if you have a long-term illness? And there is no specification of what that illness might be.
Dr. Springle, would you?
Yeah.
Thank you.
I would say in general, if we look at the categories, the reason that most of these long-term illnesses, sickle cell disease, kidney disease, heart disease, diabetes, COPD, cancer, smoking, the reason these are in that category is because if you have a long-term illness or disease, you're more at risk of the complications and morbidity, mortality, even from the disease. And so it is safe. The biggest thing that there may be some safety issues with is if you have history of some anaphylaxis, which is severe allergic reaction to some component of a vaccine you may have taken before. It may be important to look at the ingredients in the Pfizer or Moderna vaccine or whichever vaccine you may be taking to make sure there are no ingredients that are in there. You can find ingredients on the CDC website for pretty much any vaccine. And so that would be the major contraindication. I think, as a pediatrician, there are times when I don't give a child vaccines because they've had chemotherapy and they're not going to work. So if you've got significant immunosuppression, like your immune system is just not working from a medication or from an illness, it may not be wise to do that. You'd have to speak to your doctor to see if it would even work to do the vaccine. But in general, most people with chronic disease, when we look at the number of people that have died, they say, well, is it COVID? Was it the pre-existing conditions? it's all melded together, and we don't know which one is which. In the end, we just know that COVID probably made it worse. And so in general, we really want people that have chronic disease to be vaccinated, which is why they're in that 16 to 64 category that's coming up next. They drop all the way to 16 as far as the age groups to vaccinate, and it's based on, pre-existing conditions. So should be safe. Now, there's something specific, it may require you kind of asking your doctor, because there's so many diseases and medications and other processes that we may not be able to answer here in this forum. So,
thank you, Dr. Springle. Dr. Cease, this next question is related to elderly parents who have an appointment scheduled for the 16th of February, but that appointment was canceled, and then they were advised by a representative to go to the Kmart Plaza on Tuesday, the 16th, and that they would be seen since they had an appointment scheduled previously. Is there a way to guarantee that they will be seen?
I don't know that I could answer that there's an absolute way to guarantee. I would say get there first thing in the morning, if possible. Try to get there, because if my understanding is they are honoring those appointments as if they were still scheduled, but that changes, again, based on vaccine supplies. And the earlier you get there, the more likely you'll be able to have that. And again, they're doing their best to honor all those second dose appointments that had to be canceled. But I can't say with 100% certainty of a guarantee, but I would say just make sure you get there in the morning to ensure that. If you, I know that they're looking at those, particularly those that were canceled, and prioritizing those over just another walk-in.
Thank you, Dr. Cease. Dr. McFadden, could you speak to how the vaccine interacts with other vaccinations, i.e. flu, shingles, pneumonia, and is there a window or a time period when you should not have other vaccinations in close proximity to each other?
That's actually a really good question. There is, when you get the vaccination, aside from getting a little card that you're going to get a date and time for when you got your vaccines, you can bring that with you for your second and just for your own records. You're also going to get some instructions from the nurse or the team that's administering the vaccine. And some of those instructions will talk about refraining from getting other vaccinations. And I think that period of days may be 2 weeks. 2 weeks is about the time which they're telling you not to get those other, probably because we don't know how this particular vaccine might have some interaction with, say, the flu vaccine or the shingles vaccination. A lot of folks who have those shingle vaccinations will have some side effects. And if you compound that with the side effects you could have from this vaccination, there's a lot of uncertainty there. So you will be advised to refrain from getting, and they'll ask you when or have you gotten a vaccination within a certain time frame when you show up at that appointment. So that's something that you'll want to have in mind before going, or be ready to answer once you get there for the vaccination.
Excellent. Thank you, Dr. McFadden. Dr. Springle, this question comes in: how will the vaccine affect those trying to get pregnant and may have had complications prior to?
There should really be no effect. In fact, in some of the studies, they say they didn't study pregnant women, meaning they didn't enroll pregnant women in the studies with Moderna and Pfizer. However, women got pregnant in the study. And so there's really been no indications that there's any risk factor for being vaccinated, either while breastfeeding or when you're pregnant. They haven't been able to study that, but they haven't seen any issues with that. And if I think of vaccines in general, I mean, pregnant women get vaccinated for tetanus, flu, and everything else. And so I don't see why there would be any problems with that. There are some myths out there about some, synconectin, some type of protein that interacts with the placenta that's in the, but it's hogwash. It's not true, but there is some rumor out there about that causing miscarriages and things like that, but that's just not true. So there have been pregnant women in the study that continued in the study, and there's no issues with that as far as we have seen with pregnancy or breastfeeding. So,
thank you, Dr. Springle. Dr. Cease, the participant writes on Facebook, our appointment is set for tomorrow. Should we go or should we wait to hear if the vaccine is available?
If you have an appointment and no one has notified you that it's been canceled, absolutely go.
And this kind of is related. I'll phrase the question since it's there, but I think you just answered it. And the question says, I have an appointment set in my chart. How will I be notified of a cancellation in the event of? So
you will be either notified through my chart or through a telephone call. So you will have a notification. They won't spring it on you, when you get there that it's been canceled. So there will be a notification sent to you either through my chart or from a phone call.
Thank you. Dr. Springle, understanding that children have not been in any of the previous groups to be vaccinated, when that time should come, what are your thoughts regarding vaccinating children, and if there are any other existing conditions that would prohibit children from being vaccinated?
So I was trying to find a study for my 13-year-old to be in so she could get her shot. So that's my opinion on vaccinating kids. I want my whole family vaccinated. Right now it's age 16 for the Pfizer, 18 for the Moderna, I believe. They're doing studies right now for 12 to 15-year-olds. I think they have enough in the study that they may be ready by the summer. That may get pushed back to the fall, but I know they're studying 12 to 15-year-olds, and the next group will be down to 9, the last I heard. So the goal is, I don't know where the end result or how young they're going to vaccinate kids, but part of reaching herd immunity would involve children because I'm seeing kids with COVID in the daycare setting in school. I had had another positive kid from school yesterday with COVID. So they're still coming in, they're still positive. So, and they're going to protect the kids are going to the grandparents' houses and that kind of thing as well. So I think it's important to vaccinate kids. I don't know of any contraindications for kids that are any different from adults. And we'll have to wait and see what the studies show in those age ranges to make a more definitive answer. But as vaccines go, who gets more vaccines than anyone? Kids. I mean, they're vaccinated very often in their early years and do fine with it. So no problems with it.
Thank you, sir. The next question, Dr. McFadden or Dr. Cease, and it's related to not the vaccine per se, but the question is, are there any mental health or behavioral health implications related to COVID-19 or the vaccination?
That's an interesting question. So I've not heard of any mental health issues surrounding the vaccination or COVID-19, other than the fact that, if you consider anxiety and depression, we all have been affected in some ways with our mental health over this past year. And so we've all had to adjust and to deal with stress and all that brings from this past year. But in itself, related to COVID-19 or the vaccine, I may need a little more information with that question, but I have not heard of any conversation specifically around mental health and the vaccination or the infection itself.
And I would just echo the same thing that Dr. McFadden said, particularly around the anxiety and depression. My clinical work is in the schools. I do school-based health in our Title I middle schools, and the number of positive anxiety and depression screens, and Kevin Sprinkle can probably attest to this as well in his pediatric practice, is significantly higher than I've seen in the last 5 years that I've been in the schools. And certainly we know that those numbers are on the rise in our country, likely globally related to this. And then I think the parent stress, particularly for those who are doing virtual school for their kids and trying to juggle a work life, or just the demands of having your child at home and trying to help them school is very different. So I think the struggles are real, and I think please reach out, talk to your provider. If you're noticing changes in your children, please talk to your pediatrician or family physician about that, because these can be really silent, and we don't always recognize the differences that we're seeing in our kids. But just, if you're at all concerned, reach out and talk to somebody.
Thank you, Dr. Cease. Dr. Springle, were you going to respond there?
Yeah, for the vaccine, certainly not any psychiatric condition, but I have heard of some scattered cases of post-COVID psychosis. Some of that could be ICU related, ventilator. You get a lot of ICU type psychotic type issues. But also I've heard just after the disease, my aunt ended up in the mental institution after her COVID diagnosis a couple of weeks ago. She just got home, but she was fine. She had COVID and she ended up with psychosis. And so there are some reports out there about that. And of course, the depression, the anxiety, the memory loss, the brain fog. So some of that long hauler stuff, you probably would qualify some of that in the mental health arena, because it's affecting their ability to learn and function and their cognition and all that. So I think we are going to see a little bit more of that. But with the vaccine, absolutely not. I haven't seen any of that. But I think with COVID, it can do pretty much anything from what we've seen. So, but that's the only thing I wanted to add.
Thank you. Thank you, sir. This last question, I think, after receiving the vaccine, how long should the patient isolate from others who may not have yet received the vaccine?
I can answer that. You don't need to isolate from anybody after you've had the vaccine. After getting both doses, it's probably another 2 weeks before you've had the full effect of having your immune system be primed and ready. But I think the important thing is that even if you've been vaccinated, we still need to practice our public health measures. So still wear a mask around other people, still try to watch your distance unless it's somebody who's in your household that and keep your distance outside, and certainly keep washing our hands until we get to the herd immunity that Dr. Springle mentioned, which is, depends on who you listen to, but some of them are probably between 70 and 80% of the population being vaccinated. We can't really let our guard down from that. So again, you don't have to isolate, but it takes 2 weeks probably for your immune system after your second dose, and still use your precautions in the community.
And I'd like to add that part of that, I'm sorry, Kevin.
No, you go ahead. You go ahead.
Part of that reason is because you can still get COVID after being vaccinated. And you can also still spread COVID to someone else. Even if you don't have symptoms of COVID, you can spread that, because the studies that were done did not have really any clear say over the people that don't have symptoms with COVID. They only tested the people who had symptoms of COVID, not just everybody didn't get tested on day X and day 2 or whatever that may be. So you can technically still have COVID, you can technically still pass COVID to someone else, which is why, as Dr. C said, you still have to be protecting yourself and others with masking and distancing, et cetera.
I was just going to add, the CDC recently came out with the recommendations saying that if you had the vaccine and you're protected, that if you're exposed to COVID, you don't necessarily have to quarantine after you're vaccinated, but it still would mean if you're not quarantining, the masks are still really key. But that's just another thing that CDC came out with. I think that was probably this week, about quarantine on the backside of that, just that when you're exposed, you don't necessarily have to quarantine if you're vaccinated, but still you need to do all the other safety things with the mask and that type thing. That's just.
I think on the recommendations, there were some time restraints on that. Like you would have had to have the vaccination within 3 months. So all of us are in that group right now, but
Right
you know, we're later in the year, September 18th. If my wife tests positive for COVID and I've been around her, then, you know, according to that guideline, I would have to be isolated. But right now we're in that, everybody's in that 3 month period.
We are right at the end of our time and appreciate you all so very much. I do want to pose this last question, and it is, I have survived cancer 3 times, and I have had a very bad reaction to the flu shot. Should I take the vaccine? Dr. Springle, you're unmuted, so we'll talk that.
And we don't know what the reaction was, I guess, with the flu shot. You know, I assume it's not an egg allergy or something like that. It's hard for me to answer that question for you. I mean, if it was truly more of an anaphylaxis, I don't know what a bad reaction is. Did you stop breathing? Was it, you know, severe wheezing? Was it, you know, how bad was the reaction? You know, the flu shot and the COVID vaccine are 2 totally different vaccines that don't have a lot in common per se. So being a cancer survivor and looking at the risk, I don't know your age or those type things, but I would encourage it, at least, especially talking it over with your primary physician who knows all of your medical records, I think is important. But I certainly would become educated. So many people that I talk to are just talking. They're not talking to anybody. They're in an echo chamber, just talking to people that they know instead of going to their doctor or asking a health professional. So what I would advise you to do is just ask your doctor just to get more insight based on your specific condition. But in general, I would probably say yes, unless there's a known problem with a component in the vaccine. So that would be my short answer to that. I don't know if you guys have any other thoughts.
No others chiming in. I see Dr. Gillespie, you've unmuted there.
Yes.
I'm gonna leave that question and just, I don't know if you want to respond to that, but I'm just going to say we're done with questions, and I just want to express my appreciation to you all for bringing this information home to the community tonight. Thank you for that, especially the news is covering that the mass site for vaccinations closed early and lots of folks are a little bit on edge. So the timing of this is really perfect. Thank you so much, Dr. McFadden, Dr. Springle, Dr. Cease, and Dr. Gillespie. I know that you were unmuted. Not sure if you were going to comment on the cancer question. And after you, I'm tossing it back to Pastor Dogan. I'll say Dr. Dogan too. We'll just all, respectively give you that title tonight. Bow down to your wonderful leadership in our community. PhD doctor, how about that? And thank you all. And thanks everyone for participating. Dr. Gillespie.
Thank you so much, Pastor Mills. I cannot claim the doctor title, but tonight I'll be an honoree. How about that? I really do appreciate it. I just want to take the opportunity as well, Pastor Mills, to say thank you again, Pastor Dogan, to the Urban League of the Upstate, and also to the NAACP leadership and members and all the constituents and participants on the call today. We at Prisma Health, we are just so honored to be able to give you, provide this forum tonight and share vital information to our community. I also want to just note again that a lot of this valuable information that we discussed tonight is in that community toolkit that Dr. Cease posted tonight. And Dr. Cease, are we still collecting emails so we can keep communication? So what I'm going to ask before we close, and I'll pass it to Pastor Dogan, if you could please place your email address in the chat. We will send you updated information that's located on our community toolkit and the vaccination rollout as the information comes into us. We'll be updating that. I think, Dr. Cease, that's been updated daily. And so please place your email in the chat if you would like to receive additional information to stay up to date and informed And we really appreciate this time and this forum that you've given us and provided to us tonight. So thank you so much. And Pastor Dogan, we'll pass it to you, sir. We appreciate it.
Can I just say one quick thing, Pastor Dogan, before that? So the toolkit that I put in there is linked to the Prisma Health website and just has the content. The email that we will send is more of an email newsletter, and it'll have links to not only the toolkit, which really is about how to navigate MyChart, how to help your community get on MyChart and get an appointment. So again, if you have people in your church or in your neighborhood or just your network that you could help, this is a way we can help walk you through that. But it also has links to lots of other great articles. There was a Facebook Live that Prisma Health did. There's one from one of our great OBGYN colleagues who has a blog post about the pregnancy issues. So and it has a link to FAQ. So a lot of the questions that you've asked tonight, there's more information to that. So that's what these emails will link you to, that to be getting an e-newsletter.
Thank you. And if Pastor Dogan, if Kim or someone from the Urban League of the Upstate can submit those emails to us, this record to us, we would really appreciate it.
Well, thank you. Melinda Gillespie, thank you for helping us pull this together. You have been a joy to work with. Dr. Cease, Dr. Springle, Dr. McFadden, and Pastor Dr. Stacy Mills, thank you so much for hosting tonight and giving all the wealth of information. Listen, I want to thank our community. Our community has shown up tonight, not only through registration, but also through social media, from Facebook to YouTube TV. Thank you so very much. Listen, I want to personally thank our support staff at the Urban League of the Upstate that helped us bring all of this together. Ms. Kim Arnold, Dr. Angie Moulton, and Matthew Long. So thank you so very much to all your technical support. What we will do, just so everyone will know, and because you may want to or need to make some decisions to stay in this or not. But what we would do, because we did not record tonight, we wanted everything to be transparent and we wanted everything to be free flowing, and we didn't want to utilize this platform or want anyone to feel as though that we were imposing on any of their privacy tonight. If you want to see this again, you can always go to our Facebook page. But what we will do is that Kim will make available to Prisma Health everyone that registered tonight. And so if you will receive the newsletter that Dr. C spoke about, and if you do not want that, I'm sure there's an opt-out that you can choose. So everyone will at least receive one newsletter, and we hope that you will receive it daily. That will probably be the easiest way to facilitate this. Listen, I want to quickly, if you just give me 2 minutes, I want to quickly thank the NAACP of Greenville County, Reverend J.M. Fleming, president, and the entire staff and the executive team at the NAACP of Greenville County. I also want to thank all of our elected officials that are on tonight. And also, we want to make sure that healthcare is accessible to all. So we know Prisma is there. They're one of the leaders in healthcare in our community. But I want to also recognize representatives from New Horizon and representatives from the Greenville Free Medical Clinic that are on the call tonight as well. So thank you, Susie. Thank you to board members of New Horizon for being on also tonight. And we also want to remind everyone that the Urban League of the Upstate and the NAACP of Greenville County will also host for our faith leaders on February the 25th at 1:30. That email will go out to our faith leaders that we have information on. And then also our YPs will be hosting, and the medical university right there at Prisma, along with the Medical University of South Carolina, will be hosting an event in conjunction with the Urban League in the next couple of weeks as well. And then last but not least, our EOD, our Equal Opportunity Day event, will be on February the 28th. That's a Sunday, the last Sunday of this month, celebrating Black history, but also shining a light on all of the wonderful things that are going on in our community. And we hope that everyone would join us. You may join us via special Zoom and or social media platforms. Listen, good night. Thank you again. And to our community, you are awesome. Thank you so much for being a part tonight.